This is Terry Cole, and it's my first walkthrough of a brand new content that I've created for the Austin Nonprofit Group, and I'll be sharing it on mightyforce.org afterwards. Street Youth Ministry YouTube video channel on the Mighty Force playlist. So you can find it and try to take advantage of it there. My name is Terry Cole. I have been a nonprofit leader since 2008. I have been a Salesforce admin and user since 2012, implemented our own implementation of NPSP over the years and all the expanded products since. I've been a Salesforce MVP and community presenter since 2013. And I love supporting the Salesforce community, and I have grown so much in my ability to do things thanks to the community, and I love giving back. But I do have this one request. If you don't have a favorite nonprofit homeless organization that you support, please consider Street Youth Ministry. But Mighty, we interacted 13,000 times last year with clients. They made 1,153 changes to their lives last year, and we had 667 different volunteers helping out by doing service projects, clothing and food donations, and we do everything with Salesforce. So with that said, I'm going to move on to today's topic, which is outcome management. I took these definitions from Salesforce. I have no real interest in debating the definition, but this whole area builds on top of program management and is pretty separate from program management, except it's all wrapped together and intertwined with it. So these are three definitions taken right off of the NPC Salesforce webpage. Activities. This is what you plan to do to achieve your desired outcomes. Outputs. These are things that you do during your activities. So you end up enrolling a certain number of people, or you distribute a certain number of counted items or disbursements or whatever. You have a certain number of classes or sessions or discussions. So this is your traditional area of program management. Planning activities, scheduling them, logging who participates, logging what happens during the sessions or the interactions or the drop-bys or whatever it is. And that is program management, and that's a ton of work to do there. And Salesforce has a pretty decent way of tracking that, and in both NPSP and NPC, they're not the same. It's two different, one's a package and one's a product, but it's two different things. They're both free, and they do exactly the same thing, even if they do it in different ways with different names. The piece we're here to talk about is this outcomes piece. The changes expected of the participants or the stakeholders as a result of your activities. So this is the so what. So we had all the activity so that we cleared so many, tons of trash, or we had all that activity so that we cleaned up so many miles of river, or we had all that activity so that we got, so many people housed, or we had all that activity so that we got so many people earning above a living wage for our community. Those types of things are the outcome. They're not the activities that led to the outcome. They're the outcome. Some of those outcomes might be super easy. They just happened like almost by themselves. And others might be the result of, hundreds of hours of sweat and tears by your staff. But it's an outcome, and we count and measure those as well. So that's kind of the definitions. Now, translation. All of that is a little hard to deal with. So service deliveries are things you do. That's program management speak. They're things you do. An hour of a class session, a food bag given away, a meal delivered, a referral to someone in need of something if you're a navigator system. So those, in our annual report, it's 13,059 visits with clients last year. And so that's the activity we have. Outcome indicators are individual assessments tied to a specific point in time where someone or something is on a scale relative to your mission. So, a person might walk in and report that they're currently homeless, and that can become an outcome indicator. Or they can walk in and say, I'm currently unstably housed, and that can become an outcome indicator. They can say, I don't have a job, or I have an income below a living wage for my community, and those can be outcome indicators. And so these are conditions that exist. And probably if you have a formal intake process, you can capture a lot of those indicators initially. And it's real important to understand that I'm using the word outcome indicator as if like it's after it's all over. But if you really want to do what is the holy grail about management, you really want to know what it was near the beginning. So you need to define your outcomes such that they can be maybe housing, homeless, unstably housed, new housing or new temporary housing, housing. So you have a range of answers, and including things like maintained and not a problem, because you'd like to have a uniform way of kind of capturing this, whether they're at the beginning of the program or the end of the program, whether they're qualified for your program or not. So something to think about. And this, I'm making it about human beings, but this can be about the conditions of a riverbank or the conditions of a forest or, condition of a park with no trees, whatever your mission is. This really is a lot more the domain of case management, and you may recognize some of these things as being a case manager's job. They're certainly intertwined with case management. If you have case notes, there's a really good chance you could restructure how you do case notes and begin capturing outcome indicators if you're not already. And it's not that you have to stop capturing the narrative, but you have to give people the ability to break down the narrative into these individual components. So, for example, after some engagement with your programs, you may notice, that someone lives in transitional housing, or that they have completed a supported housing application, or they have a job now, but it's below living wage, or they're on emergency food stamps, or they've applied to receive a Pell Grant, or they've started community college. Those are each indicators potentially they're probably indicators if you work in poverty. They could be indicators if you work in education. But your mission has indicators that all kind of surround your activities and your strategy. And so you may have one case note file for each visit, but you may have dozens of indicators depending on how rich a situation is going on. And so, listed on this page, there's at least 10 different indicators tied to at least 2 different time frames, and some of the indicators overlap, such as the housing one. But others there wasn't an initial indication noted, but now there is, because they've discovered they have a love of education and applied for a Pell Grant and have begun college. And so it's kind of organic in a way, but you have to plan for it. So that's kind of the overall translation. Now I'm going to go back to Salesforce pages for the last time, and then we'll move on to my custom implementation. So this comes from the outcome management product, which is part of NPC, which is something we're probably none of us are using, and it is not part of NPSP. And this is their data diagram for it. And there's a whole bunch of components here, and honestly, I'm not sure how many of them are useful or not. But over here we have our program management things. We have programs, benefits, which is a service delivery in the past. They don't show all the program management. There are also schedules of activities and so on, but that's the program management piece. What outcome management is adding specifically is this indicator assignment. So tied somehow to a program is the notion that, hey, we care about certain kinds of indicators, and we're going to define them, and we're going to tie them to programs and activities. And that's what you need to understand is if you may have many programs in your org, or maybe you just have one, but each program can have different indicators that are involved in what they do. I mean, if you work in poverty overall, maybe you have a subsection that works on education and a subsection that works on employment, and a subsection that works on, housing and food stability or what, home life. And so maybe you have different indicators for each of those programs, or maybe you just have one program with, which is my case. I have one program and we have like 60 indicators, and maybe that'll change one day, but that's how we structure it. So that's their, and they have definitions of all these, and I don't know how well thought all these are. I'm not entirely sure it's fully functional. As I said, probably none of us use NPC because of, anyway, probably none of us use NPC. So let's move on to a custom solution for NPSP. Now, I've been doing this for nearly 10 years. So this may not be the most modern approach. And if I could get a mulligan on this, I would probably do some things differently. And I'm going to note those for you. But I know it works, and I know it's valuable, and I know we can do a lot of things with it, including some simple things and including some really complicated things. But you can do this in your NPSP org with custom objects. First thing, you need this indicator assignment object, and you can call it whatever you want. Ours happens to be called a client note. There was no such thing as outcome management talked about widely when we built it, and we just said it's going to be a client note, which is not a long narrative, but rather a little piece of a client note. Probably today, I would probably call it a client note element, and I would probably group them together into a client note, but no matter. And it needs to be structured so that you can report on it and analyze it and help guide people to making it. So you're going to want to have some kind of listing of all the client note types that they can have, and we talked about, 7 or 8 of them just in the previous examples, but your organization has a bunch of things you care about the people or things that you work with or alongside, and you need to make a list of those, and those will be your subtypes, in your definitions of indicator assignment objects. And so if I had to do it all over again, I would have made, like actually the outcome management module does, the outcome management product does in NPC, I would make it a regular object with records so that it could be managed from permission sets on the non-admin side by some program supervisor in a particular program or program director. So if I had to do it all over again, I would not make it a pick list as I did in my org on an object. I would instead make a definition object and let those records be created. It's far easier to maintain, in my opinion. So then you're going to need some kind of status. And we started out with a simple three systems. We needed 3 things. We thought there would just be some notes that are just that are really to be ignored, and so we just had a like it's nothing. And then we had it's something they want to do. It's something we're discussing that they want to do, and then we had one that it's something they have done. And now there are enough assessment tools in the world that most all of us are kind of agreed on some notion of there being 5 or 6 point scale. 0 is we don't know. 1 is it's needed, but not really anything is going on. 2 or 3 might be, it's needed and not done yet, but we're working on it. 4 might be it's done. 5 might be it's done and we're maintaining it. And 6 might be it's never been a problem. It's stable and it's never been a problem. And so there are a lot of national assessment scales for a bunch of different causes that have kind of coalesced around this general idea. Perhaps they have a 100-point scale and they have ranges of, 10s that sort of mean kind of these same things. But generally speaking, the idea is the lower the number, the earlier you are in the process, you probably need a indicator of we don't know, like a 0, and you probably need an indicator of it's not a problem and stable or something like that. And, and that can be like maybe potentially the max value. You can separate those out if you really want to, but a lot of assessment scales have just built those into kind of the sliding scale. And, the lower the number, the earlier it is in the process, and they recognize that there's some kind of want it but not doing it, working on it, have not only have it, but have kept it a while, and so on. So I personally, we have now back retrofitted that scale into it. And we actually defined a verb to each one of these. So we have a verb like working on or want, interested in, don't know, you know, new, maintained, never an issue. We have verbs, or I mean, I guess some of those aren't verbs, but anyway, we have these words that go with it, and we have a one-to-one association between the word and a number, 0 through 6. And so that's how I would do it all over again, because that's kind of how we got there. And then we also have something on there that we call is unique, or we have an archive checkbox that we turn on to let us know that it's not unique, or that we have invalidated it for some reason. You might also want an invalidated flag if for some reason you have entered a wrong note, or you think you have. I'm a fan of not deleting records, but invalidating them. So that's another thing you could add on this basic element of capturing outcome. But you're going to need a unique, because you might have more than one case manager or staff member working with somebody, and you're going to need to know that you're not double counting outcomes. They need to be made unique across some time period, and this is kind of your tool for doing so. I'm not aware of any Salesforce capability that kind of helps you make it unique to the person in the time frame. You can potentially do that in a report, but not easily for multiple items. And you can certainly do it in Tableau, but not easily for a bunch of items. So I recommend that you kind of do it at the record level. So anyway, and then you're also going to need, you might need other things. You might need attachments, tasks, images. Certainly you might need a comment field, of a short nature. It's possible you want to make this your case note and add a very long field, but so here's my example. At Street Youth Ministry, our mission is to know, love, and serve clients well. To that end, we work on 4 general things: achieve more stability, more sobriety, more connection to God, more connection to a faith community. And we do so by enabling relationships. So clients set simple goals by just mentioning them in their discussion. There's no form or checklist. And we record achievement in our follow-up encounters as they are mentioned. Again, no form, no assessment. It's just case notes made by the staff members who interact with our homeless young adults on a daily basis. Every interaction has some notes. If we don't have notes, we call it a social visit. And we have social visits, but we monitor for people who are only having social visits, because obviously we need to find a different way to engage with them. So your application could vary, but so for us, it's very simple. We have contacts; those are our clients. We have this client note, which is our outcome indicator, and then we have this thing in the middle that's our service delivery. We are using volunteer hours for it. Today, I would be using a service delivery of the program management model, but we started doing this long before there was a program management model. So we are using volunteer jobs to track service delivery types, and volunteer hours to track an actual service delivery. So, and we use shifts to track scheduled recurrences of program events. And you can kind of see how it's almost exactly the same. In fact, you will find a 100% correspondence between PMM and volunteers for Salesforce in the data structure. And so it's what made it possible. So this is a very simple example, and this is all we use for almost a decade. So really, to begin doing a really good job of outcome measurement, this might be all you need, is this one custom object. You have to be doing program management tracking somehow, and then you add this one object that lets you track outcomes and classify them and mark them as unique and report on them. So that's what we did. And here's our contacts. It doesn't really matter, but we create, a couple thousand, we create 1,000 or 2 contacts a year. If you've never made a dashboard like this for your org, it's a really fun dashboard to make. Just track how many objects you have and bin them by the creation date and year, and you kind of have this kind of a graph. Here's our volunteer hours. You can see that, and since we use it for program management mostly, including volunteers, we have a lot of these. We created 21,000 volunteer hours last year, records, and most of those are created by staff and as a result of their daily interactions with clients. There's not the same clients every day. It's not scheduled. It's all ad hoc. And so we have to capture it, and we have flows to help them manage that. But, program management is a big data entry job, and everybody has a way of solving that, whether it's rosters and flow, and Apex that creates the records, or whether it's a flow that loops through and creates the records. Whatever you do, that's not outcome measurement. That's just tracking your program. But at the same time you're tracking your program, I'm kind of a fan of giving your frontline staff the responsibility and the opportunity and the ability to capture outcomes. So this is our client note, and you can see that, while we captured 21,000 volunteer hours last year, we also captured 6,000 client notes last year. And these are single phrase, they're single phrase comments that get mapped onto the subtype and get mapped onto the scale of 1 to 6 based on the verb they choose. And so that we have these, and then some flows do a little bit of work after the fact, and we report on them on a regular basis, and it's really done nice for us. And just because it's a lot of work, I also want to show you how it can be a lot of benefit to your staff. We review on a weekly basis how many of the outcome indicators are being used. We notice that, like, improving self-care is one of the biggest things we do, and improving housing, improving employment. Those are things we do, and you would kind of expect a homeless organization to do those things. We don't do as much mental health care improvement as we'd like to see, transportation, a whole bunch of stability type things, get worked on. And these are at the bottom of our list because they're frequent. Our staff is always reminded of them. But every week we review the top of the list that only has like one. So, we have somebody who decides to go back to high school or get their GED, or open a bank account, or starts volunteering somewhere else. So we review all of these so that the staff can be reminded the breadth of all the possibilities that they can talk with about their clients to help move them into a more fruitful and stable and self-sufficient life. And so that's actually been a big plus to our staff to get to, without getting into the nitty-gritty details of every client, to kind of look at these outliers and go, oh yeah, that's really cool. I wonder if I could do that with my client to help them. And so that's been kind of a really fun way to take the work of this and turn it into better service that the frontline team can respect and enjoy and celebrate. So here is an example. We've been doing this for years, although I just ported it to Tableau. But all that's going on here is we take all of the notes that are created in 1 month, and we have a flow that goes through and says, I only want to count, a particular indicator as done one time in this month period. So I'm going to archive all the others if it was created more than once this month. Maybe we noticed it every single week. Maybe the client came in every week and we talked about that they still have their job, and we noted it every single week. Maybe it was different staff members who don't even know that they're creating the notes, or maybe they're just being dutiful. But we created those. We're not afraid of creating duplicates. It's okay. We like it, actually. But to report on it and count it as an outcome, we kind of need to deduplicate it. And so these are deduplicated, but you can see, we have 37 people made 103 changes in June. And that's kind of cool. And you can see exactly what they are. And in fact, this is a live Tableau where people can click on it and hone in on it. You can't get down to who it is, but you can kind of learn about it. So, we had, we're faith-based. So we have some faith-based changes. We have some reconnecting with God changes. We have some sobriety changes and a bunch of stability changes. And we have both things that are completed and things that are being worked toward. So that's just an example of what you can do. And we send this out to our donors to show how they're having impact. We're faith-based, so we send this out to our prayer team so they can be praying for more to go on and celebrating what has gone on. So you can do this with just the one record and including it into your program management record keeping. It's not easy, but definitely can do it. And you don't have to have Tableau to do this. We've been We've been deduplicating manually for years. It's only recent that we actually automated deduplication, and we've been reporting on it just using exporting the report to a spreadsheet and graphing it. I've mentioned that we do duplicate with a flow automatically. It's the kind of thing you can easily do. All we do is when somebody creates a new flow, we have an auto launch flow that says, what did they just set as a indicator? Is it archived? If we are, we don't have to do anything. But if it's not, then we need to know, is it something that's being worked towards, or is it something that's done? If it's one of those, then we're going to pull similar records for the whole month, and we're going to determine if we found a record that's not archived that's in the same time period. And if so, we're going to archive this goal. Otherwise, we're going to leave it be. And that's the whole deduplication in a nutshell. And it takes place every time somebody creates a note automatically. And it's pretty fail-safe. Maybe we get a duplicate that sneaks through every once in a while because somebody messes with it after they've created it, but we generally don't expect anyone to change a note after they've created it. So pretty easy. So you can do this with operational reporting, meaning regular Salesforce reports and dashboards. We have exported the data. You could do this with Tableau, but we have exported the data to a Google spreadsheet using regular SOCL that just runs every day. And the spreadsheet is built so that it finds out how many unique people are doing things and how many are doing changes. And we basically have this kind of statement justification of existence, and it's an eye chart, but we have engaged with 47 people in the last 14 days, and 22 of them are engaged heavily. And of the 22 that are engaged heavily, 18 are making life changes. Now, since only 22 are engaged heavily, that leaves 25 that aren't, but only 8 of those are making life changes. So we can conclude that an engaged client is 2.5 times more likely to be achieving goals. We're not sure it's causal, but month after month after month after month, year after year after year, this relationship has continued to be true. And so we love having that kind of proof of it works. And it's just live data on the web. You don't need to do live data on the web. You can update it, monthly or yearly or whatever, but it's pretty cool. So that's kind of my example, and really enough to get you started. There's some generalized kind of framework that I put together to create your own. I don't think my system will work for many other people. I wouldn't even build my system for myself today. I'd build it with the changes that I mentioned. I would not build a much more complicated system for myself, even from scratch, because this really works. Define an indicator with some type of flexible and extensible framework. I would suggest an indicator and then an indicator assignment object, 2 different objects. Indicator to define it so that you can add new subtypes by just adding a record, and a indicator connector object that has a lookup to your, you make it master detail if you want, but has a lookup to your definition, and has a lookup to your activity and formula field for who it is, and all these elemental data objects that we have. Data things of, scale and so on. Then you'll need a flow or two to efficiently create those as part of your program management work. If, like me, you care about deduplication and other types of quality issues, you also want to build some reports or flows that flag notes that seem odd, whatever that might mean. In my current record, I told you we implemented with checkboxes initially instead of like a single verb that kind of sets a scale of 1 to 6 or 0 to 6. So it was illegal to have both it's been done and it's being worked on set at the same time. But it sometimes happened. And it seemed odd to have neither checked. And so we looked at both of those conditions on a report monthly and kind of worked through it to make sure we had confidence in our data. Likewise, we discovered this notion of duplicate, the same goal being logged by multiple people. And generally speaking, that's actually positive in our field because it's reinforcing it with the client and everything. But it's also inflating our number and by quite a bit. So it's not going to lend itself towards credibility. So we do deduplicate it. And we ended up with the flow to make sure that's the case. And you'll need reports and dashboards and list views and with charts to help your team access data quickly to make sure their work is being represented well. And you'll probably want to put some of these charts and graphs and lists into your ongoing team meetings so that they can see how their work is being represented and take pride in it. That's really one of the big benefits of this is we're no longer measuring how busy we are, but we're beginning to measure effectiveness and change, which makes people excited. Eventually, you may wish to decide how you want to use these indicators on the individual level. We don't currently do much with it, but we're very much thinking about creating some type of automation that lets us compare how many indicators a person has that have gone up over the time we've known them and how many indicators they have that have gone down in the time we've known, and maybe even how many indicators there are of in general. So perhaps we have 10 indicators. We've logged 10 different indicators, and of those, 6 have gone up and 1 has gone down. So that would imply that 3 have stayed kind of the same. That does not seem like a bad formula field to have somewhere in a little graphic icon for the program team to see right on the contact. They can see that somebody's kind of stale, or they can see that somebody's made a lot of improvement and simply reinforce that. We hope they're doing that already because our staff does. We are large enough now that, each staff member has a first time with every client, and each staff member has a reunion when a client goes away and comes back for a while. And so there are a lot of sort of blind encounters there that can benefit from CRM and informing everybody what they're dealing with when they are working with somebody. So you can use these indicators on an individual level to improve the program. And you can also, of course, use them on a combined level to improve the program. We've already mentioned how the team gets excited about seeing their work represented and when the outcomes goes up. Then you can also decide how you want to track if demographics or age distribution affects the distribution of outcome. That's something we do right on our homepage. It's way back here, but we actually have a bunch of subgroups that are defined, and the spreadsheet actually cranks through. And so right now we are, let's see, right at this, when this snapshot was taken, if you were heavily engaged with us, you're 2.5 more times likely to be making change. If you are female, and this number goes up and down, but it's, if you are female at this moment, you are 68% less likely to be doing that. If you're Black, you're 200% more likely to be doing that. If you're Hispanic, you're 90%. So it's pretty near the norm. If you're white, you're actually only 66% likely to be doing the normal. So that it just kind of helps us break it down a little bit by demographic to make sure we don't have long-term systemic bias. It goes up and down by the makeup of our clients and the engagement level of our clients, but still looked at across a year, for example, it's a really good indicator. And it did flag that we had some Hispanic systemic barriers in place, and we've worked on that, and this number has absolutely gotten better over time. So you can use outcome indicator to prove you don't have bias and to identify bias and to show you're making change to get rid of bias. Likewise, we have teens in the program, but none of them are heavily engaged. It's kind of typical, sadly, of a 17, 18-year-old person there. They need help, but they don't stick around long. And so, it's just the way it is. This number is not always this way, but teens don't make up any of our engaged clients, so we can't really tell you about whether there's any bias against them other than none are doing it. So obviously there's some bias, I guess. If you're in your early 20s, you're 117% likely to be doing the norm. And if you're in your late 20s, you're 104% likely to be doing the norm. So the more mature you are, the more likely you are to be getting this benefit. If you're young, it's not as effective, and that's not always been the case, but it's the case right now. So you can decide how to make use of these. Now, the holy grail of outcome management is to look at a particular program and brag about it. When everybody started, this is how they were. And when everybody finished, they were a lot better, or some percentage of them were better. That's kind of the holy grail. And to do that, you have to do more work. You can't do what I just said. You can't achieve the holy grail without doing the work I just mentioned before. You must have individual indicators in order to ever hit the holy grail. But once you have defined an indicator, you can build an assessment tool. And an assessment tool just takes a number of indicators and puts them together and says, that's what we are going to include in the assessment tool, and then applies it to an individual and gets the indicators created corresponding to the answers that are given, whether it's self-service or whether it's done by your staff or both. So you can build an assessment template. Sorry that it cuts off. So this is the assessment template and an assessment elements. And all our assessment element does is name the subtype of our indicator that's going to be present. So we assign assessments for initial check-in, initial intake. And we have an assessment for when somebody comes back after a long absence. And we have some assessments just for particular interest areas like housing or employment. And so you can create these assessments, and you can then create a flow that, let me show what's going to happen to the data. So so first you have a contact, then you choose an assessment template. By choosing the assessment template, it means there are a certain number of indicators in it, not an infinite number. Nobody likes long surveys. And then you're going to loop through all those assessment template indicators, and you're going to ask about the status of this person, and you're going to create an indicator, and you're going to bundle that indicator into an assessment group, just so that you can go to that assessment group later and say, well, this was the assessment group created at client intake. So with just a little bit more work, you suddenly have an assessment tool that lets you do, surveys and intakes and create this structured data that you can then use in all the ways we've already talked about, plus do some additional work to start comparing before and after. So here's our brief intake assessment has only 6 elements to it. So it's meant to be quick. And, so we're just kind of trying to find out, do you have housing? Do you have ID? Does mental health seem to be playing, a negative role right now? Do you have employment? Is sobriety or substance abuse playing a role right now? And since we're faith-based, does faith seem to be playing a role right now? That's our quick assessment. And we don't share the assessment directly with clients. Instead, we ask our staff to do it after they've had their first kind of deep interaction. And we actually let each staff member do it after they've had their first deep interaction, because some interactions reveal more than others. And so it can just quickly guide them, and they can say, I don't know. That one's a 3, they can say that one's a 0. I don't know. How ID, he said he had it, so that's a 4. We know he has it. Mental health seems fine. That's a 6. Never been a problem. Employment doesn't have, that's a 1. Sobriety, we didn't discuss, don't know. I'm just going to list a 0. Reconnecting with God, don't know. I'm going to list a 0. So, in the time it takes me to tell you, they created that assessment and 6 indicators. And because you build You build formulas that roll up from the elements of the assessment or the indicator to the assessment itself group. The average score and the total score roll up to that. And now you actually can compare it against another one and say whether things are going up or down. You can group all your new intakes together and say, wow, the people who came in this week, this month were, more needy or they were less needy. You can repeat the same type. You can create a more detailed assessment or a particular topic assessment for completion at a course or midterm in a course, and you can it'll look exactly the same. The roll-ups will work the same, adding up scores and completeness and so on, and you can then put them side by side in a report, and you can say, well, look, on first intake, here's our entry point assessment for June. And here's our exit assessment point for June for the class that had, and there are 12 records in the start, and only 9 of them finished. So there are only 9 records at the end. But look at the score, it went up by 2 points. They moved from, which means move from interested in it to working on it, or working on it to maintained it, or whatever. But it moved up by 2. That's kind of the holy grail of assessment tools, and it's right there for the taking once you've built this this practice of including indicators in your program management. And we have the little add assessment button right there to the client. Also notice, it's helpful to the program staff to know what data is missing and to have a note saying, hey, fix it. Once they create the assessment, they can pick what one, brief intake, and then they get asked these questions. What's the housing status? Do they have, and like I said, they just answer the question. And the score gets assigned based, in our case, on these numbers in parentheses, just assigned based on the verb you pick. Your organization might pick a different verb and a different score, but it just gets assigned by a decision, and that's it. Then you roll it up to the assessment group by summation and average, and then you report on it in a report grouped by the same month and the same assessment template. And now all of a sudden you can be averaging all of the assessment records with that same name, not the same person. No private data is kept private at that point because you're just averaging and showing the average instead of, so here's our housing status last year. And we weren't, this isn't particularly complete. This is what we call an automatic assessment, but in terms of completeness, in fact, you can see, and what completeness means is we created a record for everybody in the group, but maybe they don't have a score. And so 71% of them had scores, and 24% of them had a score of 4 or more, which is our level of new, that means new, maintained, or never a problem. So they've achieved it. And so, you can see that October we had 25% housing attainment rate. November is 29%. Same for December. January, don't know why, but it was 47%. February, it's lower, it's back to more seasonal norms, 32%. Same for March. April, still going up. So we can watch what's going on, and we have the average score. The average person is, and with 24% attainment, you can see that the average score is less than 4. And in fact, the average score is, planning it. The average score represents that they're planning it. This average score represented that, if you round it to 3, means they're working on it. But generally speaking, most of our clients are planning housing on average, but 40% have it. And you can see the count of records in it. So now I mentioned something about this. This is called an automatic assessment. So looping through and asking questions, that's a manual assessment. But because your case managers are creating indicators all the time, or if you have a process where they're creating indicators all the time outside of surveys, then you can do something called an automatic assessment where you say, I would like to assemble assessment about housing. So I want to, but I don't know if I have housing records. So assemble an assessment for each of the clients in the following list and do your best. Find the latest record, in a time range. And so that's what we do a lot of, is this assembling an automatic record. And so, anyway, for us, it works very nicely. You can see that we have, and it's pretty easy to assemble an assessment. But I think I'm going to stop there because the base and assembling assessment there's a lot going on. All that's really going on in this flow is we're saying I want to create automatic assessments for a certain, and I pick the template. I say what time range I want by giving a start date and an end date. I find all the people we worked with in that time, and then for each of them that we worked with, I create an assessment that has a type of automatic. And that's it. I create that assessment group record and it's empty. But there's a flow in the background that says, oh, he's created an empty assessment group with a type of automatic, so I'm going to go make it for him in the background. And so it gets created. And actually, we can do a whole year's worth of clients all at once. So we say, I want to do housing assessment for every client we worked with last year. And so that's, I want a housing assessment. The December 31st is the end date. I'm going to look back 365 days last year. It gets all 1,000 clients we worked with, and it loops through them all and creates an assessment record, puts it in a group. Puts it in a record collection and then dumps it all out to Salesforce, 1,000 records, but they're just creating 1,000 records that are empty assessment groups with the type automatic. Each one of those 1,000 records then triggers a flow to go and create the assessment. And honestly, that's all that's going on there. Is you get the assessment, you get the template, you loop through each template type, and you go find an indicator if one exists for that person and that indicator, and you assign it a score and create the record and do the next one. And we can't run 1,000 of these without hitting an apex limit unless we move it to a synchronous branch of flow. And we've done that, and we can create 1,000 automatic assessments all at once and have no problems. It takes a minute, but only a minute. So that is my talk, and I'm going to stop there. If you're only getting started, I hope you absorbed that there are a lot of benefits to beginning to track outcome measurements, outcome management indicators. I hope that you learned that you have to be doing program management first. If you haven't done that, you've got to start. And there's nothing wrong with starting collecting program management activity at the same time as outcome indicators. But you can't do a lot with the data until you have a lot of data collected. I hope that you learned that you're going to have to do it as a custom solution in NPSP. I hope that you learned that you can do a lot with just one object in terms of pretty cool reporting for your program staff, as well as your management and executives and your donors and the public. I hope you got a lot of cool ideas about that. Then I hope you learned that once you've built that framework, if you are the type of organization that uses surveys and before and after tests and stuff like that, you can begin to include those as data generators for your object, for your outcome indicators. And you can compare those before and after in meaningful ways that can show, whether your housing is going up, attainment is going up or down. how much you're moving the needle. And make no mistake, it's usually not easy to move the needle. So don't be shocked if the needle's only moving a little, but you keep moving that needle a little, and all of a sudden you have a lot done. And then I hope you learned that you also can kind of do automatic assessments. We have 4 types of automatic assessments. I didn't go into great detail on it, but we have a first assessment and a last automatic assessment. So for any particular person, if we serve them, we may commission Salesforce to go off in the background asynchronously, create a first known assessment and a last known assessment. So that allows us to gather all the indicators we have, and we have a completeness number. So that tells us how many topics we have ever talked about with them. And it lets us show what their score was on average when they started and what their score is the last known scores. And that's pretty cool because that can be on the contact record, as I said, to kind of drive how we stand with people. And it's not for nothing to talk to donors about the impact you have across a years and years span. So I'm going to stop and let you send me questions and give me feedback and contemplate how you can implement outcome management in your org as a starting point, giving feedback to your program, giving feedback to your sponsors, executives, donors, and public, and then begin incorporating more and more advanced features like surveys or tests or assessments and automatic gathering of first known or last known information in a period of time. Thanks much. Bye.